My name is Katie Gielison, and I'm the Program Director of the Combined Internal Medicine Pediatrics Program at Emory School of Medicine. MedPeds at Emory combines the best of internal medicine and pediatrics within the Emory and Children's Healthcare of Atlanta systems. Residents will be rotating between medicine and pediatrics every 3 months and be able to integrate internal medicine and pediatrics training across the spectrum of life. There are a lot of things that make the Emory Internal Medicine Pediatrics program really special. I think one of the biggest things are the training locations where our residents are able to rotate. First and foremost, there's the Children's Healthcare of Atlanta system, which is the only freestanding children's healthcare system within the state of Georgia. And what that means practically is that you really get to take care of the entire state of Georgia, including patients from rural areas and the greater Atlanta area, and patients from all different walks of life. Secondly, there's the Emory University healthcare system, which includes patients getting cutting-edge, research-based care in an academic medical center. And last but certainly not least, there is the Grady healthcare system with Grady Memorial Hospital, and that allows residents to care for patients who have high healthcare needs in an academic medical center. So the MedPeds curriculum, I think, is a little bit unique from traditional MedPeds curriculum in that both medicine and pediatrics rotate on a very similar schedule called a 4+1 schedule. What that allows you to do is to be able to rotate with your medicine and pediatrics colleagues regularly and engage in the medicine and pediatrics curriculum on regular intervals without missing a beat. Threaded with that, we have our MedPeds specific curriculum, which includes dedicated time to engage in advocacy, and then once a month having 2 hours of dedicated time that's protected to engage with your MedPeds colleagues, joining together and creating that fellowship and MedPeds identity that's really important to you. This also allows you to identify research opportunities, whether it be benchtop research, clinical research, or things that are a little off the beaten path, like advocacy research or medical education. One of the great things about Emory is that there are a lot of MedPeds faculty embedded across the multiple healthcare systems where you'll be working. That means that there are lots of mentors to help you decide on what career is best for you in MedPeds. MedPeds folks tend to pick something that's a little bit different from what's traditional, and that means that there needs to be somebody to help mentor them as they explore those different career paths. So when you enter into the MedPeds program at Emory, you'll be paired with a faculty advisor who will follow you over the course of your 4 years of training, helping you to understand what your career should look like, and also helping you to identify mentors within the healthcare system, whether they be MedPeds, medicine, or pediatrics, in order to coalesce and articulate what that career might look like. One of the things that we worked really hard to identify are core MedPeds faculty who have a lot of experience in advocacy. We know that MedPeds trainees want to have the ability to take care of their patients in many different ways, not just clinically. So we're very lucky to have 2 core faculty who are very much engaged in advocacy in the greater Emory and Atlanta community. So first is Dr. Stan Sonu, who is the Director for Child Advocacy in the Children's Healthcare of Atlanta system. He also is the Medical Director of the Strong for Life program and the Medical Director of the Health Law Partnership that Children's Healthcare of Atlanta runs. Secondly, we have Ronnie Rutledge, who is a faculty in the Grady healthcare system and another core faculty in our program. And she has been integral in voter rights advocacy and helps to run the advocacy curriculum within the MedPeds program. We're so excited for you to be interested in our program and really grateful that you have decided to apply to our program. If you have any questions at all, please feel free to reach out to any of the core faculty in the program and myself. Our contact info is on our website.